Dementia physically dismantles the brain. In mild to moderate Alzheimer's and Lewy body dementia, patients experience a steady, devastating erosion of memory, attention, and the ability to perform simple daily tasks. This cognitive decline is driven by a severe shortage of acetylcholine. That is a vital neurotransmitter, the chemical messenger the brain requires for basic cognitive processing. Right now, modern medicine cannot stop the physical destruction of these brain cells. The biological hardware is permanently breaking down. This creates a difficult therapeutic dilemma. If doctors cannot stop the neurons from dying, they must find a way to rescue the signals that are still firing. Since rebuilding the neural network is impossible, the clinical goal shifts to chemically maximizing the function of the neurons that are left. This introduces Donepezil, a first-line daily medication. Donepezil does not attempt to cure dementia. It is a strategic pharmacological tool designed to buy the patient invaluable time. It relies entirely on a preservation strategy. Rather than attempting to regrow lost tissue, the drug chemically stabilizes the brain's rapidly dwindling supply of resources. This stabilization is specifically targeted at the mild to moderate stages of Alzheimer's disease, a window where there are still enough active neurons available to benefit from the intervention. Donepezil achieves this temporary hold on a patient's cognition by executing a highly specific microscopic blockade directly at the cellular level. This animated model shows a synapse, the microscopic gap between two neurons. When the brain sends a signal, it releases acetylcholine across this gap to activate the next cell. Immediately after the signal is received, the brain's natural cleanup enzyme, called acetylcholinesterase, moves in. It breaks down the acetylcholine to clear the gap for the next message. Donepezil is an acetylcholinesterase inhibitor. It actively chemically blocks this specific cleanup crew from functioning. With the enzymes frozen, the acetylcholine is forced to linger in the synapse. This artificially thickens the concentration of neurotransmitters, significantly boosting signal strength and overall cholinergic neurotransmission. Because this drug only amplifies existing signals and does nothing to repair the underlying structural damage to the brain, the cognitive benefits are modest and gradual. To manage this process, doctors must titrate the once-daily oral dose, starting low and increasing it slowly. It typically requires 2 to 3 months of consistent use to accurately assess if the drug is providing a benefit. While blocking the cleanup crew helps stabilize the mind, altering chemical levels in the brain inherently triggers a chain reaction throughout the rest of the body. Cholinergic receptors exist throughout the entire human body. This means Donepezil's chemical boost inevitably impacts the heart and the gut. Cardiologically, the drug can slow the heart rate, a condition known as bradycardia. This significantly increases the risk of fainting or syncope, particularly if a patient is already taking heart medications like beta blockers or digoxin. Gastrointestinally, it can cause severe stomach irritation. If a patient combines Donepezil with NSAIDs, common painkillers like ibuprofen, the risk of developing stomach ulcers and dangerous internal bleeding spikes. Patients also face an opposing interaction with anticholinergic medicines, such as certain sedating antihistamines or bladder control drugs. These medications neutralize Donepezil's cognitive benefits and worsen patient confusion. Prescribing Donepezil requires managing a precarious biological ecosystem. It demands rigorous patient selection and continuous medication reviews to ensure the treatment remains safe. When carefully balanced, Donepezil succeeds in preserving a patient's cognition and daily functioning for a critical period. But the biological truth is visible in this progression graph. We see a clear stabilization plateau during the mild to moderate phase. However, as the disease advances to the severe stage, the brain produces too little acetylcholine, and the curve drops sharply. At this threshold of severity, treatment must pivot. Doctors may add or substitute other medications, like memantine, to address the advancing symptoms. A single pill cannot hold back neurodegeneration forever, which means it can never be relied upon in isolation. Optimal outcomes are only achieved when Donepezil is treated as just one piece of a comprehensive, whole-package dementia care plan. The non-pharmacological necessities are vital. Patients require active cognitive stimulation, dedicated support for their carers, and robust safety planning at home. Actively managing comorbidities, treating a patient's depression, sleep disorders, and chronic pain is just as crucial to maintaining their quality of life as boosting their acetylcholine. Donepezil is a profound, albeit temporary, medical shield. It is a tool that maximizes human connection and independence for as long as possible, while science continues the search for a permanent cure.